Okay. So, do you know what pharmacogenomics is?
Not really. I imagine it has something to do with genes because I hear genes and genomics, but past that, nothing.
Yeah, so pharmacogenomic testing helps physicians target treatment and medications to patients' genetics. Incorporating genetic factors into the prescribing process can help improve efficacy and reduce adverse effects. So, now that you know what the definition of pharmacogenomics is, what is your opinion on the topic and how do you think this will affect you?
Well, me personally, it would be very important going forward, but actually for two reasons. My father has MS, and so I would think that if they could test my genes to see if I would be have a propensity for having multiple sclerosis, that would be really good to know going forward. Although I'm already older than he was when it started to affect him, because it affected him later in life. Um, Also, I'm the oldest of four girls, and all three of my sisters have problems with their thyroid. One has hyperthyroid, and the other two have hypothyroid, right? Is that right? Something like that.
Yeah.
And so I always make sure that my doctor knows about that. They have tested me, tested my blood, etc., and I have no problems with my thyroid. But if they could do testing on my genes, I think that would be interesting to know. And actually, there's a third factor. I have heart problems, so I don't know if the genes are supposed to be able to show everything, right? So maybe they could use my genes to uh, test me for future problems because I've had a bypass surgery, and so they use veins for bypass instead of artery, and I know that the veins can wear out sooner than an artery would. So I really don't want to have my chest opened up again 10 years down the road. Thank you very much. But if they could detect that in your genes, and then I think once you have problems with your heart, you always kind of worry about it. And I asked my cardiologist, how are you going to know if that's going to have to happen? And he goes by the symptoms. So if they could know for sure using my genes, to me, that would be good. You know, more than good. I mean, it would be excellent. So,
Okay. And do you think that if researchers continue to practice pharmacogenomic testing, that it will become a part of routine physical?
oh yes, because if it starts to discover things for people that they had no idea was if a woman could know that she's has a propensity for breast cancer, for instance, and could do something, change her diet, whatever, or have a mastectomy in defense against breast cancer, of course, people would do that. Not everybody, because I think some people like to, hide their head in the sand and say, "No, no, not me, not me." They don't want to face that because it's scary. It's really scary. But I think a lot of people would take advantage of it and would say, "Absolutely, yes, please test my genes." So
All right. Thank you.
you're welcome.